Parasite burden and severity of malaria in Tanzanian children. Although almost 600,000 African children die each year from malaria. Malaria is an illness or disease that is due to parasites of the genus Plasmodium in the blood or tissues.
Malaria is an infection with one-celled protozoans called Plasmodia. Plasmodia spend some stages of their lives in female Anopheles mosquitoes and some stages in people. A female mosquito sucks in Plasmodia when she takes blood from a person infected with malaria. In her intestine, male and female forms of Plasmodia combined into zygotes. Zygotes burrow into cells in her intestine and form tiny cysts. Within each tiny cyst, the zygote divides many times. Eventually, the tiny cyst bursts, and Plasmodia migrate to the mosquito's salivary glands. She can now inject Plasmodia into a new victim. In people, Plasmodia first travel rapidly through the bloodstream to the liver. They invade liver cells and again divide. The liver cells eventually burst, releasing thousands of Plasmodia back into the bloodstream. The parasites next invade red blood cells, where they divide again. They release more Plasmodia, which in turn infect more red blood cells. Each time the red blood cells rupture, the person suffers an attack of chills and fever. Some of the Plasmodia eventually develop into male and female forms, ready to infect another mosquito.
Malaria, killer of children.
Old Grace Abba has malaria. For 2 days, her mother has been giving her medicine brewed from herbs and bark. Without proper treatment, she could get worse and die. Her mother has no choice but to walk the 26 miles to the nearest hospital. According to the World Health Organization, malaria claims the lives of over 270,000 children in Nigeria every year. That's a third of all the children who died from malaria in Africa. But now Nigeria is fighting back. It's adopted one of the most effective anti-malarial drugs, Coartem, to treat the disease.
We can develop the best possible drug, but if the population has not access to this drug, then of course it will not have an impact on the disease.
Dr. Pagnoni is a research coordinator at TDR, the Tropical Disease Research Program based at the World Health Organization. He's working with local researchers and the Nigerian government to see if trained community members can diagnose the disease and dispense drugs properly, treating before malaria becomes life-threatening.
In order to increase access to health interventions, we have to involve the community. And if we involve the community, we need to empower the community.
Among those recruited are mothers, including Rizikatu, who has 5 children and 2 grandchildren. She knows all about the suffering malaria can bring. She lost a daughter.
She had a fever, but we didn't know it was malaria. With the knowledge I now have, I know it was.
Her first patient of the day is a 4-year-old boy. Rizikatu has been trained to look for obvious signs of malaria, like a high temperature and yellow eyes. She decides he needs treatment immediately, without a diagnostic test. But as part of the research, a blood sample is taken to confirm Rizikatu's diagnosis.
All these new drugs would stay on a shelf if the implementation research does not show and does not give us solution on how the population can access these new drugs.
Application in medicine. Combination therapies based on artemisinin and vaccine RTS.
In all conflicts that occurred in tropical regions in the 20th century, malaria was responsible for a greater loss of military manpower than enemy fire. Last month, new findings revealed that naval researchers are getting closer to ensuring that won't be the case in the 21st century. Sergeant Adam Ross has more.
One of the most persistent threats to military readiness continues to be malaria, but the fight against the virus may soon be revolutionized by the work being done by researchers at the Naval Medical Research Center in Silver Spring, Maryland.
we were able to show that in a small sample, we could achieve 100% efficacy with this vaccine. And what that means is that in these subjects who received a full course of the vaccine, we actually challenged them with malaria infection by exposing them to mosquitoes infected with malaria. And to our great delight, none of the subjects in that group developed malaria.
The results of that test, done in conjunction with the medical work of private industry, represent the biggest step toward a true malaria vaccine.
To get any drug or vaccine licensed through the FDA requires a series of detailed and carefully conducted research studies. So there are several more studies that we're going to have to do. But we're very hopeful and are setting an ambitious timeline of 3 to 5 years to achieve licensure.
The vaccine uses a whole organism approach, where a weakened version of the parasite is introduced to the body. This type of vaccine has had success against other diseases.
By using this whole organism approach where we're giving the parasite, we're going back to an approach that has been used since very early in the beginning of vaccinology. In fact, if you think about Edward Jenner giving his smallpox vaccine, what he did is he gave the whole organism. So we're doing the same thing. We're giving a weakened version of the whole organism, and when the body sees that, it mounts an immune response.
The successful test is the latest development from more than 40 years of malaria research by the Department of Defense.
Disadvantages. There is no drug that fully ensures the elimination of malaria, and malaria is common in tropical and subtropical areas of Asia, Africa, America, and Oceania. Diseases: encephalitis, hemolytic anemia, kidney failure, meningitis, and pulmonary edema.
Encephalitis. Encephalitis is an acute infection and inflammation of the brain. Usually caused by virus, encephalitis is characterized by headache, photophobia, drowsiness, and nausea.
Pharyngitis. Pharyngitis, commonly known as sore throat, is inflammation of the pharynx caused by viral or bacterial infection and characterized by pain, fever, and swollen lymph nodes in the neck.
Herpes zoster. Herpes zoster is an infection of the nerves supplying certain areas of the skin, caused by varicella zoster virus, which also causes chickenpox. After an episode of chickenpox, the virus can remain dormant in nerve cells for several years and re-emerge as shingles. Symptoms include itching, tingling, pain, and rash that turns into blisters, which gradually crust over, leaving scars, usually on one side of the body. Lymphatics. Lymphatics are channels in the lymphatic system similar to blood vessels that transport lymph or tissue fluid from the body and eventually drain back into the bloodstream.
Anthrax. Anthrax is an acute infection caused by the spore-forming bacterium Bacillus anthracis, a microbe that lives in soil, which mainly affects livestock. Humans are infected through skin contact, ingestion, or inspiration of spores from infected animals or animal products. The most common form of infection in humans is cutaneous anthrax, which affects the skin, and pulmonary anthrax affecting lungs, characterized by ulcerative skin lesions and severe breathing problems, respectively.
Discover more at Focus